Welcome to the P.A.S. Report podcast. If you're tired of censorship, outraged by government abuses, and thirsty for real insights, then you're in the right place. Get ready, because here, the fight for freedom never ends. Here's your host, Professor Nick Giordano.
What's up, everyone, and welcome to the P.A.S. Report podcast. This is your host, Nick Giordano. I am glad you could join me today. Make sure you are following and subscribe to the podcast so you never miss an episode. Also, visit the P.A.S. Report website, pasreport.com, and share the episode with your family and friends. Also, do not forget to check out the new America's Founding series on the P.A.S. Report, where I talk about some of the forgotten patriots that have helped shape this nation to give us the idea, the concept of liberty and freedom, who fought and bled for it, that so many in our government today want to take away. It's why I have a great guest coming on for today. I have Dr. Simone Gold coming on. She's going to talk about her new book, Selective Persecution, the Legalization of American Fascism. It is available for pre-order, and I have links up at the PAS Report website, pasreport.com. Dr. Gold, so glad you could join me today. How are you?
Great. So fun to be here. Thanks, Nicholas.
I think COVID changed a lot in the United States, and I think that the American people's distrust of government is well intended, as we see. But I actually want to go back prior to the coronavirus. You're a doctor in the field. Prior to the pandemic, how did you feel about your colleagues in the medical industry, the Centers for Disease Control, the National Institute of Health? What was your opinion prior to the pandemic?
You know, I love that question. I have not been asked that in a while. So I am the daughter of a doctor, so I have the unique perspective of knowing what medicine was like from the 1970s onward, like first-person experience. My father had an office in our home. He would see hospitalized and nursing home patients during the day, and in the evening, he would do private practice in the evenings and the weekends. So I have watched medicine evolve from, I guess, a golden age of really in the 70s, 80s, maybe 60s, 70s, 80s, to when I started practicing in the 2000s, right? And it has been a terrible, slow slide into government bureaucracy that does not prioritize the doctor-patient relationship in any way, shape, or form. I chose the specialty of emergency medicine, which became very much a huge amount of pressure to comply with protocols. I didn't understand at the time, but really essentially Medicare would set policies and protocols. Medicare was really doing this at the behest of big pharma interests. You know, you get protocols for certain antibiotics and certain tests that you should do. And, you know, so we became very protocol driven. And an interesting aside, maybe you didn't expect this part of the answer, we doctors on the front lines really didn't pay any attention to the CDC and the NIH, or really the FDA for that matter. That may sound surprising because all we've talked about the last 5 years is the FDA, CDC, and NIH, but a practicing doctor never checked with those agencies ever. I can't think ever in my career. The only time, I suppose, was when the Ebola scare came about, and I saw that the CDC was terribly dysfunctional in his approach to the Ebola virus. So if I had any impression, it was negative, but it wasn't a factor in frontline doctors' daily practice at all. One of the myths that we heard talked about a lot during the COVID years was, you know, not using drugs off-label, like hydroxychloroquine or ivermectin off-label. That is a complete fabricated expression as far as relating it to a doctor's reality. Off-label means using a drug that has not been marketed by the pharmaceutical manufacturer for that indication. So, for example, Pfizer might come out with a drug that's good for cellulitis, skin infections. Doctors discover it's also good for pneumonia or urinary infections. So they might use it for those things. Those are off-label because they haven't been marketed for those things or approved for that. There's many reasons why drug manufacturers don't market for specific conditions, but doctors use it. Off-label prescriptions are about 30% of prescriptions. So what difference would it make to me if a drug is on-label or off-label? I mean, it became the rallying cry in 2020. It's off-label. Like that meant anything. It didn't mean anything. So the short answer is CDC, FDA, NIH didn't have any meaning at all to practicing physicians.
And I think that is important because it was largely irrelevant. You know, CDC, NIH would do some research behind the scenes. They might issue bulletins and guidance that some people would look at, others wouldn't. But then all of a sudden the pandemic hits and everything begins to change. We begin to see that this emphasis that the CDC and the NIH is like some sort of gold standard. And listen, there's no government entity that's a gold standard, right? Nobody ever deals with the government saying, that was a pleasant experience. I wish I could do that again.
Right.
But you describe in your book that after you spoke out at an event and the White Coat Summit speech, that began to mark the beginning of a persecution where the government really came at you hard and began to target you. Tell us what happened and why do you think your message was seen as such a threat?
Right. So I really didn't know what I was stepping into. I was a board certified practicing emergency physician for many years. And 2020 exposed a lot of lies, a lot of propaganda by our government and by our media, which was the arm of the Democrat Party. It was very obvious. And I decided to speak out directly to the American people. Really, my plan was not bigger than that. I just knew that the mainstream media wouldn't say what we doctors had to say. They wouldn't let us say it. So we stood on the steps of the Supreme Court. We had some social media influencers there filming us. They sent it out to their channels, and we became huge overnight, huge. Many millions and millions of views, tens of millions of views, which was surprising. People ask me, did I plan this? I said, I don't know. I did not plan that. I did plan to speak publicly, have other doctors. But I learned in retrospect why the government was so angry and punishing towards me. We revealed that what they were saying was a lie and that they had a financial interest in lying to the public. For example, social distancing, the 6-foot social distancing, we doctors revealed that it was completely fabricated, made up. Newsflash, January of 2024, under oath, Fauci said the same thing. So we all knew it was fabricated, and we came forward and say that.
So you were being targeted as pushing out misinformation, and yet we know that the 6-foot rule was total nonsense now.
And we knew, and honestly, anybody who could read knew it at the time. And you could feel that it didn't make sense, right? I understand that you would feel it didn't make sense, and it's true. Because if this had worked, our grandmothers and grandmothers and grandmothers and grandmothers would have told us. Like, it would have been obvious to all of human history. But I also knew as a scientist, if you could just read some papers, you knew that there was no magic to 6 foot. But what it did was it enabled the schools to be closed because schools couldn't stay open. Most schools didn't have enough footprint to be able to space children 6 feet apart. There you go. You closed the schools, economy, a lot of things that we did, that we revealed. The biggest one, I suppose, was that if early treatment worked, which we knew it did, hydroxychloroquine and ivermectin were quite effective against the SARS virus if you took it early, then you could not roll out the shots quickly on an EUA, on an emergency basis. A requirement to roll them out on an emergency basis is that there was no other treatment available. So Big Pharma had a big interest in shutting us up. And that, I think, is really what came after us hard in 2020.
Yeah, it was amazing. I'm someone that prior to teaching full-time, I worked in emergency management. I actually developed pandemic plans. Nothing was followed that we wrote, back in 2011, 2012. Everything that we put in bioterrorism plans and strategic national stockpile plans, it was all completely ignored. And I knew from the very beginning something was very wrong. And there came a point where a month into this thing, I'm asking myself, am I missing something? Like, am I the crazy one? But I quickly realized that it was a play. I mean, it was a play for power, and that was concerning to me. Now, you describe how you speak out, and now you become a target. You describe being raided by the FBI, prosecuted by the Department of Justice for speaking at an event. Do you believe that your descent from COVID played a role in how aggressively the government came after you compared to other people that were speaking out?
Oh, absolutely. I mean, we'll just use January 6th as an example. It is true that the Department of Justice tormented more than 1,500 people. I was not the only one. But it's also true many tens of thousands, hundreds of thousands were not tormented, and that they did specifically go after people who were high profile. There were not that many high-profile people that were on the Capitol grounds that day. I happened to be one of them because I had a government-issued permit to speak on the Capitol grounds that day. That's why I was there. mostly the people who were higher profile were not actually on Capitol grounds around that time, right? So they went after anyone who was high profile there, and I unfortunately was caught in their dragnet. There's no question. In addition to the Department of Justice going after me, Congress came after me. Congress targeted me because I made, I taught Americans how to get early treatment. We connected them with public information on our websites with telemedicine companies that would prescribe for them. So Congress came after me very hard. I had to endure that. The California Medical Board targeted me for free speech. So there's no question. I mean, this is what the book is filled with, is that what a government can do to a single person if they put their mind to it. I got targeted by Congress. I got targeted by the California Medical Board. I got targeted by the New York Bar. Like other J6ers, I got targeted by the Department of Justice, the FBI. By the way, a very little aside that is in the book that's not as well known, because you asked, do I think I was specifically targeted? When I moved from California to Florida, I had to apply for my Florida medical license. As part of that application, I have to show my other state medical licenses, like California. So, of course, at that point, I'd been arrested for J6. FBI Los Angeles branch sends a written letter to Florida that I had been charged with treason. So they put the correct statute number, which was a trespass, but then they type in the word treason. Obviously, this was done by a human being. You couldn't have had both the statute and the word. So, of course, I was targeted. All of that's in my book with the proof. It's fantastic.
It really is amazing. I mean, the government does have the capability to destroy people's lives, and that's why we have to always be vigilant against an all-powerful government, because you're a clear example. And you highlight it's not necessarily just government. It's the complicity of institutions as well. We could go the media. You just brought up the California medical boards that were targeting doctors' medical license, basically trying to destroy their livelihoods for daring to speak out and challenge the narratives that were being pushed out there. We saw in New York, if you didn't get the shot, well, you were terminated from your state positions. So we see the whole of society being weaponized against people that dissent. Now, you just said that you were providing ways where people could get early treatment and prevention. When it comes to something like masks, the information, the studies were done on masks about the flu virus long before the coronavirus came, long before it became political. And the fact is, it didn't stop surgical masks and cloth masks, didn't stop the spread. But even more important, the government's telling people to wear masks, but they don't tell people for surgical masks, you can only wear them for a maximum period of 4 hours before the microplastics start to break down and you got to dispose of it. They allow people to wear these disgusting, filthy masks for weeks on end, putting it in their pockets. So they weren't trying to protect our health. Now, do you believe that all these institutions, because whenever you push back against doctors or question them, well, they'll say, well, CDC guidance, NIH guidance. How have the institutions themselves become so independently corrupted? And how has this all been coordinated by the government to suppress dissent?
Centralized power is just a dangerous thing. I mean, how does China, a nation of more than 1 billion citizens, how does the CCP, Chinese Communist Party, control more than 1 billion humans, right? It's through the threat of citizen policing. It's through the threat of cancel culture, social credit scores. So that came after people hard in America. Thankfully, not as bad as the CCP in China. But
were you surprised about how compliant Americans were?
Yes, very.
Because it shocked me.
It was utterly shocking. You know, if you'd asked me 6 months prior to COVID, I would have said, oh, if the government came after people, 30% of people would have stood up.
And then like a revolution.
In a couple of months, I thought, okay, maybe 10%. But it was really, I learned later, it's 3% in the revolution. And it's probably 3%. It's probably always about 3% of people. And it's very upsetting because, you have the privilege of living in this phenomenal country that is the best, the most human freedom that has existed on planet Earth anywhere is America in the 21st century, right? The 21st century. How you can thumb your nose at the privilege of that opportunity. People kill to get here. People starve and save all their money so their children can come here. And people didn't stand up. It was heartbreaking.
Not only did they not stand up, many of them actually encouraged the government to keep schools closed, to keep the lockdowns in effect, to keep masking. And then you had the government go like full Saddam Hussein style, like encouraging people to rat out their neighbors. You know, here in New York City, there was take a picture if someone's not complying with COVID and send it to this text message in a text message. New York had to stop that after one day, after all the pornographic materials.
People sent a bunch of which I was thrilled about.
But when we look at it, how did the whole experience reshape your understanding of the relationship between medicine and politics?
Oh my gosh. Well, I think most doctors like myself, I wasn't completely naive. I mean, I always had to work around the system a bit, but I always was able in my world to work around the system for what my patient needed. You know, in my microcosm, I never had came up against a wall I couldn't more or less figure out for the benefit of my patient. I learned during COVID it was false. I learned that the government was willing to kill its people. Kill its people. I say that because if you were Medicare and you were hospitalized for COVID, the hospital was financially incentivized by Medicare to put you on remdesivir and not to allow you to take ivermectin. In other words, not just the maybe corruption of being sold remdesivir, which is a bad drug, but also why are you being blocked from using ivermectin? So I say Medicare had policies to kill people. This was news to me, how compromised hospitals and doctors could be. It was very disheartening that most doctors didn't do basic reading. I lost count of how many conversations I had with doctors that I'm like, why don't you just look at some of the research? Hydroxychloroquine, ivermectin work. And they're like, no, it doesn't work. The CDC. I'm like, oh my gosh, you know, why do people pay you to go to see you? They could just, I mean, you're supposed to be a doctor. You're supposed to read these things. And it was very upsetting. So I don't know if you know this, I've done a complete realignment of my thinking as a physician. We launched national telemedicine. It's called Gold Care. That's a whole nother conversation, but this system is broken. It cannot be fixed. Every step in the system is built towards a financial model that doesn't promote the patient's welfare. So I exited.
Well, and I mean, listen, I just noticed over the last 3 years how worse it's gotten, where it's healthcare groups. You know, the private practices are going by the wayside. It's not private practice anymore. You have these big conglomerates that are run as entities as opposed to a patient type of relationship. And I have to ask, you know, prior to COVID, you and your colleagues, some of them you may have been friends with, spoken to, talked, respected. How were you treated after?
Yeah. The really weird thing is I had 2 emergency jobs at the time COVID came. One was on a Native American reservation site. People don't know that about me. I was working 1 week a month for Native American tribe. And then the other rest of the time I was working in an area that happened to be politically conservative. I was living in Los Angeles, which is very blue, but I was driving up almost 2 hours to a pretty conservative area. Even in that area, the doctors had drunk the Kool-Aid. It was incredible. And the vast majority of doctors I wouldn't talk to. I definitely wouldn't recommend my patients go to them. They were very, there's a hard conflict between public health doctors and real doctors. I want to just call that out for people. If you see somebody who's like advocating for public health, that person is not advocating for you. There's a hard conflict. I am pretty disgusted with most doctors. At the same time, I've met amazing, amazing independent thinking doctors over the last 4 to 5 years. And that's encouraging.
It is. I mean, listen, it's hard. I had to switch my kid's pediatrician like 3 or 4 times because of information and the back and forth. My doctor, I generally have a good relationship with, and he's great. But a lot of people don't have that. And so when we're looking at the healthcare apparatus, do you think that there's any way that it could actually come back, that it could regain the trust of the American people? And do you think there's a way that we could actually get the politics out of the healthcare, the way it's been infused over the course of the last decade?
Yeah, I think it's a macro and a micro question. On the micro is you yourself as an individual, like you need a doctor. People need doctors. So on the individual level, I think there are ways for individuals to navigate successfully, but they need to be informed. That's literally why I built Gold Care. So ordinary people can have an advisor with them, a doctor in their pocket as they navigate the system. So the answer is yes, with independent creative solutions that the free market is creating. On the macro level, I do not think the system can be fixed. I'm an insider for 25 years, really since birth because of my dad. I'm an insider all of my life, and all of the incentives are pointing in a certain direction, and that direction is wasteful spending. Sometimes the spending benefits a patient, but it's almost secondary. Overwhelmingly, it does not benefit the patient, and it's ridiculously expensive for the fact that we don't have better life expectancy. We're not very healthy as a people. We don't have great infant mortality levels compared to what we should for our Western, level of living. So I do not think the system can be fixed, but I think an individual can navigate successfully within the system.
I think that's important to point out. We spend more on healthcare than ever before, and yet the results are worse and worse. It's a healthcare system that's based on maintaining, not based on actual health and prevention, and I think that's important. You face the full weight of the federal bureaucracy coming down on you. Are you disappointed in members of Congress, some of them who actually support you, some of them that spoken publicly in support, but how little action they've taken to try and remedy this situation?
Yes. Most of the representatives are very sheep-like. To be fair, the doctors were very sheep-like. I think they're very much like the doctors. I have more faith in the average citizen than the average doctor and the average congressional representative, which is pretty sad. Now, our whole system is really beholden to big financial interests. The biggest of all is big pharma. So there you go. It was very disappointing after January 6th that people who were, for example, Trump supporters didn't look more closely at the lies that were being spewed that day. So I would say overall, I am pretty disappointed in our representatives. On the other hand, the people are quite silent about pressuring their representatives. I mean, even in the last election, I think 55% of people vote, and that was a huge election in 2024. So
yeah, most people don't even get involved.
Most people don't really get involved. So they would respond. The Congress people would respond to pressure, and they have. I mean, pressure is why Bobby Kennedy is standing next to Donald Trump. So,
well, what's your thoughts on Bobby Kennedy being at the helm of Health and Human Services and leading that? Are you optimistic?
Yeah. Actually, I am. I don't know if you are. I know a lot of people have lost faith. I am not. I actually know the man personally. He's a fantastic individual. He's highly intelligent and he's highly principled. If anything, he's too good for Washington. He's a very kind human and he's very smart. There's no way he forgot the last 30 years of what he has learned. So he has to navigate in a den of vipers, quite frankly. And people on the Maha side are angry that he's not, making vaccines illegal. Well, that's not his job. We are a free nation. We need freedom. We need people to make up their own mind. That means they need access to accurate information and they need to make up their own decisions without coercion. That's it. I don't need a Secretary of Health outlawing this and outlawing that. What I need is not to be coerced and good information. And I think he has his eye on that ball.
And that's a great point that a lot of people forget. It's like this natural conflict between MAGA and Maha, yes, where, MAGA, limited government, provide information, but stay out of our lives. Maha, some people think the government should take the front role and start banning everything. And they don't realize we have a system of federalism in place. You want to ban certain types of vaccines, do it at the state level and the local level, as opposed to the federal level. But interestingly enough, as we start to see a change in administration, there has been a change in mindset amongst the people. I think that there's a lot of people looking back on the coronavirus that you could tell at the end they were fed up. They were done when they kept kids out of school for 2 years and the masking and all that. Do you think that the government the next time will take a step back and not target individuals like you? Or do you think that legal targeting by the government is now becoming the norm in America? And as the title of your book indicates, great title, by the way, Selective Persecution and Bringing Fascism to the United States. Do you think that, all right, Trump got elected, that may be good for the next few years, but ultimately we're going to stay on the collision course of government getting bigger, and more powerful?
Yes. I wrote this book because I want to alert people that the infrastructure for fascism already exists in America. Thank God Trump is in office, so it's at bay, and he'll probably dismantle some of it. But everywhere I went, there was tyranny. The FBI officers who SWAT raided me in big tactical gear, breaking down my door with battering rams, shrieking at me, handcuffing and shackling, most of them knew what they were doing was absurd, okay? The nurses who were mean to patients and patients' families because of rules that their employer made them say knew they were doing wrong, right? So I'm pointing out to people that there is like the tentacles to fascism is here. It's this over-reliance on bureaucracy. So I am kind of nervous about our long-term freedom. And this book is a bit of a wake-up call. You know, nobody told the California Medical Board to go after me for free speech. That's what they decided to do, right? They had the option not to do that. That was their decision. How does that happen? It's that all these people are in all these positions of power, teachers, nurses, administrators, bureaucrats, and they're all kind of moving in this like totalitarian direction. So this book is the antidote to that. How do you handle that? How do you push back on that and also be happy and live a happy, productive life? It's there. And I also want to shout out to something you said a moment ago, but which is very astute. The conflict between MAGA and MAHA. Dr. Robert Malone wrote the epilogue in this book, and he beautifully explains the tension between MAGA and MAHA. You will very much enjoy it.
Yeah, I'll definitely check it out. Everyone needs to check out Selective Persecution, the Legalization of American Fascism. Links up at the P.A.S. Report website, PASreport.com. And your message is so important. I mean, I've been warning about an overbearing government for quite a long time as a political scientist, so it's a welcome message that everyone needs to hear. Dr. Gold, I really appreciate you coming on the program today.
Thank you so much for having me.
Thank you for listening to the P.A.S. Report. Don't forget to rate, share, and hit that subscribe button. That way you'll never miss an episode. For more exclusive content and updates, visit us at PASreport.com and follow Professor Giordano on all social media platforms at P.A.S. Report.